Knock, knock, knock. Hello, my name is Joy. I'll be your nurse today. I'm here to do a head to toe assessment on the baby. Is it a good time? Before I do that, I'm gonna wash my hands, and then, mommy, is it okay to take the baby for the head to toe assessment? Okay, I think mommy is okay with that. Okay, before I do that, I'm going to create privacy. I'll wash my hands, I'll put on my gloves, and then I'll explain why I'm going to do this procedure. We're going to do a head to toe assessment on the baby. Okay, then I'm going to identify the baby's wrist with the mother. Okay, I'll look at the wrist, and then I'll compare that with the mother. The wristband matches, which is okay. Okay, before I begin doing anything, the first thing I have to do, I do the ABCA score. I need to assess the ABCA score. For the reasons why we do the ABCA score is because we need to assess if the baby has any breathing problem and if he has any health issues. And for this case, my baby looks fine and healthy. And then I'll go ahead and check for the ABCA score. For a normal baby, we need to do this within 1 minute and 5 minutes after birth. And the normal one ranges from 7 to 10. Okay, so then I'll assess the baby's weight. I'll put the baby in the weighing scale, and then I'll assess for the weight. The normal weight for a normal baby ranges between 5 pounds 8 ounces to 8 pounds 13 ounces. That is for the normal baby weight. And then I'll go ahead and assess the head, the length of the baby. I'll get a measuring tape and measure the length of the baby from the head to the bottom of the feet. I'll run the tape, and then the normal length ranges from 19 to 21 inches. We compare all these, the weight, the length. We are using the baby's development chart or growth chart. We'll always compare that using the growth chart. Then I'll go ahead and have a general assessment on the baby's appearance. And the normal baby's appearance, in most cases, the baby has to be symmetrical, and then she has to be well nourished without any cyanosis. I'm not seeing any cyanosis. The color is good. The color skin should be pink. When the newborn has been born, that very time is always dark red, but later on, after a few hours, then the skin will change to pink. And then the position of the baby, they have to maintain a flexed position. The way the baby looks right now, it is in the flexed position, and their fists are always clinched the way it is. They have a clinched fist. That's what it means. And then I'll go ahead and do my vital signs. In this case, I'll listen to the heart rate. I'll first auscultate the rate, the heart rate, and I'll do it epically. There are 4 positions that I do this, and I have to do this, the heart rate, auscultate in 1 full minute. And then the rhythm of the newborn has to be regular. Report for any murmurs or any findings that are not clear to you to the provider. Then the normal heart rate of a baby will always range from 110 to 160 beats per minute. Then when you're assessing for our assess the respiratory of the baby, and the normal range is from 30 to 60 breaths per minute. When we are assessing for the temperature, it is axillary position or site is the best site for the temperature. I'll just bring in my thermometer. I know babies don't like this. It's a little bit cold when you put it in their armpits, but this is the best way to do it. And then we'll assess for the temperature. The temperature ranges between 97.7 to 99.5 Fahrenheit. Okay, so when I'm done with that, the last thing I'll do, I'll assess the lung sounds. I always listen to the lung sounds at in the sides of the rib, at the sides of the in the sides of the body of the rib. That's where I listen the lung sounds, and they need to be clear bilaterally. Okay, I'll go ahead and then assess my head. When I look at the head of the baby, it looks round, which is a normal thing to see in a baby. And in most cases, the head is bigger than any other part of the body. So I'll go ahead and assess the head. It doesn't have any swelling or redness or anything. It sounds good. Then I'll go ahead and measure the circumference. I'll put my tape around the head and I'll measure the circumference. The circumference of the head is between 33 to 35.5 centimeters. And when I also assess the anterior frontal is here, and then it should always be soft. And the shape of the anterior frontal is always it's a diamond shaped, and it's always soft. It is always bigger than the posterior. The posterior is at the back. It's a smaller one. And for the anterior frontal, it usually closes between 12 to 18 months of life. And for the posterior, it closes within the first 3 months. Then I'll go ahead. And assess the face. When I look at the face, in the newborn, the appearance of the face, in most cases, they have that milia. It's called milia. It looks like pimples, whitish. It's whitish like pimples. So we need to assess that. Then the parents should not be frightened when they see this. This is a normal thing. And then we need to assess for any sign of jaundice on the face. And my baby looks okay. The skin looks okay, which is okay. Then I'll go ahead and assess the eyes. When I'm assessing the eyes, I look at the color, no jaundice. And then I'll also look at the eyelid. The eyelid, in most cases, appears swollen due to the pressure during the birth, which is okay. And then I'll go ahead and run my pen light in the baby's eyes. For this, I'm assessing to see if there is any equal and reactive, if the baby is equal and if the pupils are equal and reactive to light, which is okay for me. It sounds good. And then I'll also see for when you run the pen light, you'll be able to see if the pupil has a red reflex. Showing a red reflex is a good sign for a normal baby. And it's if you see a pupil that shows like red and white, this is especially for congenital cataracts, so you need to report this to the provider. Then I go ahead to the ears. When I'm assessing the ears, I run a imaginary line from the corner of the eye to the pinna, top of the pinna, to see if the ear is on the same level. It should be even. And then also the pinna should be flexible and quick to recall. This indicates the presence of cartilage, which is a good thing. Then I'll go ahead and assess the nose. The nose of the baby. This helps to see if the baby doesn't have any breathing problems, and if so, you need to report that. So the first thing I do is close one nair and see if the baby can be able to breathe in the other nair, and also close this other nair on the other side to see whether the baby can be able to breathe. So if there is any nasal flaring, we need to report that to the doctor. So we also have to assess the mouth. When we are assessing the mouth, we need to see if the mouth is moist and pink, which is a good sign for a normal baby. And also, I'm gonna put my index finger in the mouth, and I'm assessing for the suck and gag reflex. And for the suck reflex, it should be strong, and the gag reflex should be present. The hard and soft palpates should be intact. When you feel it in the mouth, they should be intact. And report for any cleft lip to the provider. Then I'll go ahead and assess the baby's neck. When I'm assessing the baby's neck, it should be short and thick for any normal baby. And then I should assess for any masses or webbing that are around the neck, and I should report that to the provider if there are any masses or webbing. And then I'm assessing the clavicle. When I'm assessing the clavicles, they should be intact, and we should report any fractured clavicles to the provider. I'll go ahead and assess the chest. Okay, so I'm assessing the chest. When I look at the chest, the shape of the chest should appear barrel shaped. It always have to be a barrel shaped. Any concave or convex shape should be reported to the provider. Then the xiphoid process should be prominent in a newborn baby. And then we are going to measure the chest circumference. I'll run my tape around the chest, and I'll measure the chest circumference. The circumference ranges between 30.5 to 33 centimeters. Then I'll go to the abdomen. The baby's abdomen always has a dome-shaped shape. This looks normal, and the abdomen is always prudent, like it protrudes out. It's visible, you know. So, and I'll go ahead and listen to the bowel sounds. This should be audible within the first 2 hours of life, and I'll auscultate in the clockwise motion. Okay, the bowel sounds, they are okay. And then the abdomen is soft and palpable, which is good. And then I'll go ahead and look at the umbilical cord. The umbilical cord has to be clean and dry. And if there is any redness, drainage, or swelling on the umbilical cord, that has to be reported to the physician. Then after, we have to measure again the circumference of the abdomen. When you're measuring the circumference of the abdomen, it differs with the sexes. For the boys, it is always 24.47 centimeters. And then for the girls, it is always 24.92 centimeters. The normal umbilical cord should always have 3 vessels for any normal baby. We are looking at 3 vessels in the umbilical cord. Then again, always the baby in the first 24 hours, they will always have The first stool, which is called meconium, is always dark blackish. So any baby who has not had that first stool within the 24 hours we should report that finding to the doctor. And then I'll go ahead and assess the baby's void. My baby, I'll assume my baby is having the diaper. I'll check the diaper and see the baby's void. If the baby has void, and the voiding we are looking at is the urine, they should have this in the first 24 hours of life, and the urine is always light with no odor. But if you see any pink or light orange in the diaper, that should not frighten the parent. That is okay. And then we'll go ahead and look at the genitalia, the genitalia of the baby. For the female, now I think I'll talk about the general observation of the genitalia. Both the female and the male, they always have that white, cheesy white subcutaneous gland secretion. And for the girls, it's always in the folds of the labia, and for the boys, it's always in the how they call that, in the penis, on the fold of the penis. This is okay, and it will just go away with time. And then when we are assessing for the girls, we assess the labia and the clitoris. They have to be engorged. And then we have to assess for any vaginal discharge and bleeding. If you see any discharge, this is called the pseudomenstruation. This is a normal finding in the baby. And then we also have to assess for the boys. We assess for the testicles. The testicles should be descended. If one of the testicles is not descended, this is something serious that you need to inform the provider. And then we also assess for the urethra for any abnormalities like hypospadiasis, how they call it, hypospadiasis, I guess. That is, it affects the urethra. We need to report that. I'll go ahead and assess the hip, how it is placed. We'll assess for the range of motion in a baby. I'll do this in the clockwise motion and see if the baby can have a normal range of motion. And then I'll also go ahead and assess for the bowel maneuver. And then I'll bring the knee forward and see if it can be able to have that bowel maneuver. And also we have the Ottolani maneuver, where I'll bring my hip outward and put it on the 90-degree angle. So I guess our range of motion is okay. Then when I'm assessing my extremities, I'll look at the baby's fingers and the hands. The fingers, the baby has to have 10 fingers, and the muscle, she has to have a good muscle tone and flexion. They have to be extended, which is a good thing. And then any excess, if there are any excess fingers, we need to report that to the physician. That is called polydactyly. And then we'll also do the same on the feet. We have to count the feet, the toes, and see if they are 10 in number. They have to be 10. Then we also go ahead and assess the nails. They should be soft and flexible, which is a good thing for my baby right now. And then I'll assess the reflexes. We have the palmar and plantar reflex. For the palmar, this appears in the fingers. The baby will fold the finger, I'll put my index finger in the baby's palms, and the baby will be able to wrap around the fingers If they do that, that is a good sign. And then I'll do the same to the toes. This is called plantar. And I'll put my index finger. If the baby can be able to wrap around, then that's a good thing. Then I'll go ahead and assess for the rooting reflex on the baby's face. I'll just struck the baby on the cheek and see if the baby can follow the action of the striking on the cheek where it is the reflex. Then that seems a good reflex. Then I'll also do the molar reflex. I'll try to bring the baby closer to my side in car and see if the baby can strongly support himself towards my side. If he can do that, then the molar reflex is okay. Then I'll go assess the Babinski reflex, and then I'll do I'll struck maybe I'll get a pen, my pen light or a pen, and then I'll stuck on the heel of the baby and draw and do it laterally. If the baby can fan the toes outwards, the toes will fan outwards, then this is a good sign for the reflex. If it doesn't appear like that, or if they fold their toes, then we have to report that to the doctor. Then I'll also assess I'll go and assess the spine of the baby, the back of the baby. When I'm assessing the spine has to be straight and flat. Then I'll also assess the length of the spine. There should be no masses and no opening. The openings are associated with Spina bifida, and this should be notified to the physician. I'll also run my hand laterally and see if there are no masses in the spine. This sounds good. And then I'll go ahead and assess the anus. The anus has to be patent. If there are any abnormalities, like there is an extension of the anus, we need to report that. And also we need to look at the Mongolian spots. They are mostly common on the buttocks of the babies, or sometimes they are on the legs, on the extremities. They are always bluish and black in color. If you see those Mongolian spots, the parent should not freak out. That is normal. It is normal for a baby. Okay. Then I'll go ahead and wrap or swaddle my baby. I'm swaddling the baby. I'll return the baby to the mother. I'll remove my gloves. I'll wash my hands, and I'll document any findings that I've found in my assessment. This has been my head to toe assessment for the newborn. Thank you.